Well, lung cancer is the leading cause of death for both men and women in this country. And when it comes to saving lives, doctors say finding cancer early is critical. Now, new cutting-edge technology is helping in that fight, and a Bay Area hospital was the first to bring it to patients on the West Coast. I got an inside look at how it works and why doctors say it's only one part of the solution.
Just playing a PlayStation game, I'm just driving my car from here to the yellow ball.
In this OR, the fight against lung cancer is waged by both humans and cutting-edge robotic technology.
John Muir has the advantage of being one of the first centers in the Pacific Northwest to adopt this technology.
Dr. Wilson Tsai is director of the thoracic program at John Muir Medical Center, and he's talking about the Monarch system, a robot that is designed to find cancer in hard-to-reach areas of the lung.
I'm really controlling a bronchoscope, not by holding the bronchoscope in my hand, is what conventionally we used to do. But
it looks like a video game.
It is a video game.
It is the latest in a fight against a cancer that has taken far too many lives.
Currently, lung cancer is the #1 killer out of all the cancers combined. Every year, there's about 240,000 new patients diagnosed with lung cancer, and out of those 240,000 patients, about 135,000 patients would eventually succumb and die to their cancer. So that's a very high mortality rate when it comes to cancer.
Catching it early is critical, but Dr. Tsai says the robot alone won't win the fight.
It doesn't make sense to get something like this into a hospital if they don't have a lung cancer screening program, because one is going to support the other.
So John Muir has 2 critical screening programs.
And this is for the high-risk population of patients with a history of smoking who otherwise would not be allowed to get a CT scan because they don't have any symptoms. They're just high risk. And we've seen over 1,500 patients, and some of those patients have gotten 2 to 6 scans each. The second one is called a pulmonary nodule program, and this also contributes to diagnosis of lung cancer early, and we've done over 6,000 cases since 2008, and this is anything suspicious that is seen is worked up.
Usually biopsies are done with the needle, but that gets harder when cancers are smaller.
The biggest problem with that is the fact that in about 20% to 30% of patients, you may actually damage the lung with the lung drops.
And that brings us back to this remote-controlled robot that sends a camera down your throat into your lungs without incisions.
As soon as I am 1.3 centimeters or 13 millimeters away from that nodule, then once this camera is sitting right in front of the nodule, then we take biopsy forceps or biopsy instruments such as this one, where there's a little needle on the end of it, and we could actually obtain tissue for diagnosis.
That's where pathologist Dr. Barry Latner steps in.
Time is of the essence sometimes that they're calling you in.
So here, their patient is in the operating room on the table, and time is exactly of the essence. So we need to turn around a result as fast as possible. Improvements in imaging, we're getting smaller and smaller lumps, and as a result, smaller and smaller biopsies to look at.
If the patient has cancer, it can be biopsied, staged, and treated immediately.
Essentially what we've done is decrease the time and the duration of diagnosis, staging, and treatment from conventionally 2.5 months to about 2.5 hours.
At the end of the day, the team here says it is about the patient.
I do. I actually come in, show them this is the Vinci robot. The robot can say hi to them.
A little introduction to a new approach.
Using the robot, I think it's decreases the length of stay for the patient, decreases surgical infections, and also the post-op pain.
It may look like a video game, but when it comes to lung cancer, Dr. Tsai says every advantage you can get will save lives.
I think this is going to be one of the groundbreaking technologies that really helps us treat our patients and diagnose our patients faster.
Well, Dr. Tsai says he's had patients come from across the country and even the world coming to John Muir to be screened by this Monarch system. But again, he says it's just part of a larger approach to using screening and technology to help fight lung cancer and save lives.